Wednesday, speaking about the extrinsic controls of arteriolar radius, or the flow to arterioles. And I think I kind of lost most of the class as we began speaking about those receptors and the varying affinities and so on. So we're going to pick up there, and then we'll continue on. Okay. So we spoke about the sympathetic system as one of those factors that regulated arteriolar flow. And then we also mentioned some hormones. And we know that one of our hormones has the ability to also be a neurotransmitter. So we're going to speak about it in terms of both those regards, okay? So we have norepinephrine. We have epinephrine. And we know this can be both a neurotransmitter and a hormone if it's being released from the adrenal medulla. And then we have two other hormones that we'll talk about: vasopressin, also called ADH, and angiotensin II. Oh, there should be two. Okay. Now we know norepinephrine binds to receptors that are present on most of our arteries, our arterioles. And this is alpha receptors. So this binds to alpha adrenergic receptors. Can you see this? Okay. And the most common response that we see on most of our tissues after norepinephrine binds to adrenergic receptors is vasoconstriction. And this happens everywhere except the brain. And we kind of talked about how the brain is exempt from this rule of shunting blood left and right because we're continually relying on oxygenation of our brain. Oops. Okay. Epinephrine, we know, can bind to receptors, alpha receptors, as well as beta 2 receptors. But what does it have a greater affinity for? What does epinephrine prefer? Beta 2 receptors, or the receptor has a greater affinity rather for epinephrine. So beta 2 receptors, you know, there's an increased affinity here. And so the most influential response of epinephrine is going to be its action at beta 2 receptors. Now we know if it binds to an alpha receptor, that's going to be at higher concentrations, but it's going to bind to beta 2 receptors whether it's at high or low concentrations, okay? So I'll say that again. If we have a little bit of epinephrine around, it's going to only bind to beta 2 receptors. But if we have lots of epinephrine around, it's going to bind to both, okay? So this is where we have that varying affinity. If we have a lot of it around flooding the system and it binds to both, if it binds to an alpha receptor, it's going to also cause vasoconstriction on most of our tissues except the brain. Okay, so okay, if it binds to a beta 2 receptor, it's going to cause vasodilation only on two particular tissues: skeletal muscle and cardiac muscle. Okay, so let's go over that again. On most of our arterial blood vessels, and let's just back up a second and remind ourselves that we're not speaking about the tissues themselves, but we're speaking about the arterioles that go to these tissues and the presence or absence of receptors on these arterioles. So most of the tissues in our body, the arterioles that feed those tissues, have alpha adrenergic receptors that bind norepinephrine and bring about vasoconstriction. This happens everywhere in the body excepting the brain. Specifically, we have alpha and beta 2 receptors that can bind epinephrine. We know that beta 2 receptors are more prevalent on skeletal and cardiac muscle, and we know that alpha receptors are pretty much prevalent everywhere else in the body. And vasoconstriction is brought about if we bind alpha receptors, and vasodilation is brought about if we bind beta 2 receptors, okay? So the important take-home part here is that we have vasodilation when we have epinephrine binding to beta 2 receptors, and this happens irregardless of the quantity. So at high concentrations or low concentrations, we get vasodilation when beta 2 receptors are bound by epinephrine on skeletal and cardiac muscle. And if you look at the bigger picture here, this is facilitating shunting of blood to our heart and skeletal muscles and vasoconstriction everywhere else in the body except the brain, okay? Now the final two hormones here, we haven't gotten to them, but they are pretty straightforward. Both of these cause vasoconstriction. And we know that it's going to increase total peripheral resistance and increase mean arterial pressure. Okay, we'll talk a little bit more about them in detail, but they're also hormones that extrinsically control the